I would like to welcome you to my channel, That Middle-Aged Lady. My name is Denise, and in today's video, I wanted to give an update to a previous video I had uploaded that talked about how I had been noticing this grayish blackish discharge on my panty liner from time to time. As I stated in that video, I have been postmenopausal for over 5 years now, and I was diagnosed with vaginal atrophy at the end of April of last year, so April of 2023, and put on Vagifem as my course of treatment. And I continued to use the Vagifem as directed up until about several months ago when I decided to go down from using it twice a week to once a week, mainly because all of the research I have done suggests that the least amount of estrogen we're putting into our bodies for the least amount of time is always best, even if it is just localized to the vagina. Once I started to notice this discharge, I did immediately call my gynecologist office to make an appointment, since I knew that a grayish blackish discharge is indicative of old blood, so it's still blood. It just takes longer to flow out of the vagina, and then once it hits the air, it oxidizes, giving it that grayish blackish color. Unfortunately, they couldn't get me in for 6 weeks, which was a little disappointing. Nothing like having to wait for 6 weeks to figure out what's going on with you. But then in the meantime, I noticed that the color would go from a grayish blackish to a light brown sometimes. So either it would be a light brown or it would be a grayish blackish. Never was it red, never was it pink, never was it like a white discharge, but it always pretty much remained to be that either light brown or that grayish black. I also noticed that whenever I would insert the Vagifem, usually it was about 2 days later that I would notice this grayish blackish discharge would always get a little bit worse. So it was like a little bit more on my panty liner, and it occurred just about every week that I would use the Vagifem. Getting concerned, since I know that certain cancers like breast cancer, uterine cancer, and ovarian cancer are estrogen dependent cancers, meaning they rely on the estrogen to help feed them. I thought, God forbid, if it's either uterine or ovarian cancer, the last thing I want to do is be giving it more estrogen to make it grow even more. So I decided that maybe it might be best to just go ahead and stop using the Vagifem until I was able to get into my gynecologist and see, for sure what was going on. Then a short time later, I started to experience some horrible pain in my lower back that radiated to my left side. It kind of started where my belly button was at and then made its way down to like the pelvic region. And then I also was starting to get some bloating in my lower abdomen as well. After about a week and a half of this not going away, I made an appointment with my nurse practitioner, who basically just felt around my stomach, took my vitals, said everything looked fine, and sent me on my way. So pretty much a wasted visit. And then a short time after that, I started to experience some nausea whenever I would eat. I was also getting some horrible indigestion and acid reflux that wasn't going away with my medication that I was prescribed for it. Being concerned that something more was going on, I decided to go ahead and take a trip to the ER, where they did a complete blood workup, a urinalysis, and then a CT scan with contrast. And the emergency room doctor came back and said everything came back normal. Nothing jumped out of, looking abnormal or that anything was wrong, other than I do have a large cyst on my liver that I was diagnosed with previously, so I was well aware of it. I did ask him if there was, say, a tumor on my ovary, since this pain seemed to kind of be radiating in that direction. Would the CT scan have picked that up? And he said, absolutely. He said, but there was nothing noted on the CT scan report that there was any cause for concern in any area other than the cyst on my liver. It took me time to get in to see my gynecologist, and I explained all of the symptoms I had been having to him, the grayish blackish discharge that seemed to get a little worse after I used the Vagifem, and how I decided to stop using it, and how it would sometimes go from grayish black to a light brown. Also told him about the pain I had been having in my lower back that had been radiating to my left side and how it kind of felt like it was in the left ovary region. Told him about how I had felt bloated that didn't seem to ever really fully go away, and also how I had ended up going to the ER and how they did a CT scan, but nothing other than this large cyst on my liver had turned up. He told me that when a woman enters menopause and her ovaries are no longer producing eggs, the ovaries will start to shrink. He said in a lot of cases, when they do a CT scan, the ovaries aren't even seen. So after I left his office that day, I was curious about that. So I went onto my health chart and decided to look at the CT scan report for myself, because if that were the case, the radiologist would have, or I should say should have, noted, say, left ovary, not visualized. And that did not say that on my report, so I'm going to assume that he was able to see both the ovaries And the only thing noted was that female genitals showed no gross abnormality, which is just the term that they would use to describe nothing seen to the naked eye. He further said that a CT scan usually isn't a reliable tool to look for endometrial or uterine cancer, just because you can't really visualize it that well, and an ultrasound would usually be the better tool to use. He said, and what can happen with uterine cancer is, you've got your pear-shaped uterus, but I'm going to hold it this way. He said sometimes a tumor can be hiding in the layers of fat higher up in the uterus, and so a CT scan isn't going to show that. And he said sometimes even an ultrasound isn't going to show that, because you've got to be able to look inside. He said, so really the best tool to find out if there is a tumor hiding in those layers up higher in the uterus would be to do a procedure called a sonohysterogram, which is where they start off with a vaginal ultrasound. So for those of you who have never had one, I've had a few of them done so far, but it's a probe that they put inside your vagina that they put basically like a condom over, and then they'll insert it into the vagina, which allows them to visualize the female organs, being the ovaries, the uterus, the endometrial lining, so that they can see, if there's either like a tumor or a cyst on the ovaries, if the endometrial lining is thickened or not, or if there's anything that they can tell might be causing the bleeding or the pain. After they get a good visualization of the female organs, they then insert a thin tube into the uterus, where they would then inject a saline solution into the uterus. So basically what happens is once they do that, the uterus slowly begins, the layers open up like that, so they're able to get a good look into what's inside those layers of fat. And so after that, they take the tube out, they try and get as much saline solution out of the uterus as they can, and they send you on your way. I asked if you're awake for the procedure. He said you are. I asked if it's painful. He said that's relative, depends on your pain level. He said once they insert the saline solution, you might get a little cramping. He said, but just take some ibuprofen, and hopefully by a day or two, you should be feeling just fine. He said it's really the best tool they have to be able to look in basically all the cracks and crevices, just to see if something more sinister or insidious might be there. He did the pelvic exam, and afterward said, I don't feel anything of suspicion. I don't see anything of suspicion. I have a feeling maybe this might be something else, but obviously we need to explore all of the possibilities. And so somebody will be getting in touch with you soon to go ahead and set that appointment up for the sonohysterogram, and pretty much left it at that. I did ask him before I left if it was okay that I stopped using the Vagifem, and he said, I'm going to give you the same advice I would give my wife or my daughter. He said I would continue on using it if I were you, because otherwise you're going to take one problem and turn it into two. He said, you've taken all this time to reverse the effects of the vaginal atrophy, and by not using it, unfortunately, chances are it's going to come back. And I asked him, I said, but if this is cancer, then obviously I don't want to be feeding it with this estrogen replacement therapy. And he said, at this point, because I don't really see or feel anything of suspicion, obviously it's up to you, but I would go ahead and continue on using it just the once a week. He said I wouldn't do it more than once a week. He said, but I would still continue on. After I left, I gave it a lot of thought and consideration, and I feel like we all have to listen to our instincts. We all have to listen to our bodies. And so I decided that I wasn't going to do it. I just have way too many symptoms that this could be something like ovarian cancer or even endometrial cancer. And I just don't want to take a chance. And the last thing I want to do is find out, say, 3-4 months down the road, had I stopped using the Vagifem, then maybe they could more for me about it. I can tell you that I was very anxious for them to call me and set this appointment up so I could find out exactly what was going on, not only because of the anxiety of wondering if it was cancer, but because I was in discomfort and pain between the bloating and the pain that I was feeling in my left region down by my ovary. That was something that, whatever was going on, I wanted to find out, so hopefully they could do something about it. So one day turned into 2 days, turned into 3, 4 days later, when I still hadn't heard from somebody, I finally decided to call the gynecologist office and said, somebody was supposed to call me to set this procedure up. I haven't heard from anybody yet. The receptionist was not very nice and said, well, that's because it takes time. And I said, it takes time to set an appointment up? I said, why is that? She said, they have to clear with your insurance company. She said, there's steps that need to be taken. I said, well, why not set the appointment up? And then if for some reason the insurance company isn't going to cover it, which is ridiculous, it's a simple procedure, of course they're going to cover it. I said, then just cancel the appointment. At least have an appointment on the books so that I don't have to wait longer than necessary. She said, this is how they do things, whether you like it or not, and so you're just going to have to be patient. Okay. 4 days turned into 5, 6, 7, 8, ninth day, still hadn't heard from anybody. Called back again, this time said, I want to talk to the girl who sets the appointments up. Don't want to talk to the receptionist. I want to talk to the person in charge of setting these appointments up. So they connected me to a girl named Colette, who was very nice and said, I apologize. She said, when we get the orders, we do it. We make the appointments in order of when we receive them. She said, so honestly, I was going to be calling you later today. I thought, yeah, okay. But thankfully, she did go ahead and give me an appointment. Unfortunately, it wasn't going to be until February 1st. I explained to her, I've got this discharge, I've got this pain, I've got the discomfort. Is February 1st as soon as you can get me in? And she said, unfortunately, that's the first available appointment. So that meant I was going to be waiting about another 7 weeks until I could get in to have this procedure done. In the meantime, I decided to see if I could get an appointment to see my gastroenterologist. Since I had 7 weeks to kill, I figured why not see what he had to say about it, even though I knew chances were this was somehow female related, since obviously discharge wouldn't have anything to do with a stomach or a bowel issue. But I thought, why not just see what he has to say? They got me in within a week's time, so kudos to them instead of making me wait 6 weeks. And after I told him everything I told the gynecologist about the discharge, about the pain in my back, the bloating, the indigestion, sometimes having a hard time eating, he felt around my stomach and said, I think this might have something to do with your gallbladder, which shocked me because never in my wildest dreams did I think it would have anything to do with the gallbladder. I asked him why he felt that way, since the CT scan didn't pick up anything about the gallbladder, nor were my liver enzymes raised, nor was I ever getting any pain in the right side, which is where the gallbladder is located. And he said a lot of times it can be a bile duct issue, which means that when your liver processes fatty foods, it puts it into your gallbladder, and then your gallbladder slowly releases it into the bile ducts, where that then releases into your small intestines. He said if there's some type of issue with those bile ducts, that means you're not digesting food properly, and it can cause the bloating, it can cause discomfort. He said you don't always necessarily have to get pain in the back, and he said it sounds to me like it could have something to do with the gallbladder. And so he wanted to do a colonoscopy and a scope down the throat, which I think is just always the first choice that everybody goes to. Let's make sure it's not something like colon cancer or stomach cancer or anything like that. And then after that, he wanted to do a thing called a HIDA scan. And so a HIDA scan, H-I-D-A, is where you go in and you can't eat 4 hours before you go there. And then you have to lay flat on a table. They put an IV in, and then they have this machine that it's like an x-ray machine, but it's almost like a square shape. And then they put it very close to your stomach, like as close to where your gallbladder would be without actually physically touching your body. And then they kind of watch your digestive system. And after a little while, they'll give you like an Ensure to drink that is high in fat, because they want to then see how your gallbladder processes the fat and whether or not there's an issue with your bile ducts, then emptying it into your digestive system, into your small intestines. The procedure can take anywhere from 1 to 4 hours, so you got to lay on the table for that length of time. Other than the IV, it is said not to be painful, it's just time consuming, so definitely got to pack your patience because you're going to be laying there for a little while. And so I said, okay, at this point, I'm willing to explore all options while I'm waiting to get in and have this other test done. And so the colonoscopy was set up, actually having it tomorrow, so yay. And then the HIDA scan is going to be next Tuesday, and then we'll see what the results will show after both of those tests. For the most part, my symptoms have remained the same, although I have noticed that the discharge is getting a little bit more frequent now. I used to only see it maybe, every few days or even once a week, whereas now I'm starting to notice it like every other day. It is still just a light brown in color or a little bit of grayish blackish, never a lot of it. Sometimes it's only even just a small amount, but I am definitely starting to see it a little bit more frequently. The pain in my back has subsided for the most part, although it will flare up from time to time, but I am also a 56-year-old woman who cleans houses for a living, so of course I'm going to get a little bit of lower back pain from time to time. The bloating is pretty much the same, hasn't really, gotten worse or gotten better. I do have a couple pictures that I was going to put up just to show everybody what it looks like. You know, I've had 5 kids, so I've always had a little bit of a pouch on my lower abdomen. And I can tell you that it is soft to the touch. It does feel like belly fat. And then when I wake up in the morning, it's not bad. I actually feel quite good in the morning. But then as the day progresses, it gets worse and worse until come evening, it's when it's at its worst. And then I go to sleep, I wake up in the morning, and I start that cycle all over again. First, when I wake up, I feel good. As the day progresses, it starts to get worse until come evening, I feel horrible again. So could that be related to a digestion issue? And maybe the gastroenterologist is correct, and maybe it does have something to do with my gallbladder? Maybe, but then that still doesn't account for why I have this pain in my ovary area and why I'm getting this discharge. Could be that maybe it's something to do with both of them. Hard to say. Like I told my gastroenterologist, I feel like I have this ticking time bomb inside of me that is about to go off at any time, and yet I'm nowhere closer today to figuring out what it is than I was 2 months ago when I first started to experiencing these symptoms. And that's what really starts to play on you mentally. You know, and then you start looking stuff up on Google. One minute I'm convinced, oh no, it has to be the gallbladder. The next minute I'm convinced, oh no, it's definitely ovarian cancer. And then even something as simple as a fibroid tumor. Although menopausal women that have fibroid tumors, they tend to shrink after menopause. They're also estrogen fed, meaning estrogen can make them grow. And I did have a fibroid tumor that I was diagnosed with just prior to being diagnosed with a vaginal atrophy. So maybe being on the Vagifem increased the size of the fibroid, and maybe it's just a fibroid tumor. But then I think to myself, if that were the case, then why didn't it show up on the CT scan? You know, the first fibroid I had showed up on the CT scan, so why didn't this one? So again, emotional roller coaster of trying to figure it out. But I figure at least I'm trying to do something about it by having the colonoscopy, the scope down the throat, and this HIDA scan, so that although I may not know what exactly is causing it, at least I can start checking those boxes of what is not causing it. So at least that makes me feel like I'm doing something. The other thing is that because this has been playing on me emotionally so much, and I've been driving myself crazy with it, I decided to call the doctor's office back again and have them leave a message specifically for the doctor this time to tell him that I can't take it anymore. Between the pain in my ovary region, between the bloating, and between the discharge, I can't take this anymore and I need to get in sooner. Because if I go to the ER again, all they're going to tell me is to follow up with my gynecologist, and so why waste my time doing that? This was during the holidays, so unfortunately he was on vacation, but as soon as he got back, he had them call me and say, you know, get her in sooner. So they did move my appointment up to January 19th. And so I just want to tell everybody to always be your best advocate. And when somebody tells you, well, I'm sorry, that's the best we can do, baloney. They can always do better if you put your foot down hard enough. And that's how I felt. You know, all those people telling me, oh no, February 1st is the, you know, soonest appointment we can get you in. And then I leave a message for the doctor, and all of a sudden, magically, an appointment, you know, opens up 2 weeks sooner. So be your own best advocate, be that squeaky wheel, put your foot down, and hopefully you can get results that, you know, you can get in sooner as well, or at least get the results that you were looking to get. Because I think that's, you know, the terrible part about our healthcare system is to tell somebody, well, it could be cancer, but we're not going to know for 6 months down the road because we've got to run all these tests and it takes time, and we're not going to be able to get you in until this time. And oh no, if only you would have, you know, gotten in sooner, we could have did more for you, even though it's our fault that we put you off for so long anyways. I think that's a terrible mental thing to do to people, and I just wish that there was something more that they could do with the healthcare system so that it didn't have to be that way. I think when somebody tells you you might have cancer, I think that that's something that they should be able to get you in right away to find out for sure, so that, you know, you don't have this mental anguish until being able to finally get an answer, is my opinion anyways. But that is where I am at in the process. So tomorrow I go for the colonoscopy and the scope down the throat. Tuesday I go for the HIDA scan. And then Friday, January 19th, I go for the sonohysterogram, which I'm more anxious to have than anything, since that's going to show whether or not this could be either ovarian or uterine cancer. So I will definitely be back after these tests are done and let everybody know what the results were. I'm going to keep high hopes and keep praying that everything's fine. You know, but I'm the type of person, I'm not looking for pity, I'm not looking for sympathy, I'm not looking for pain medication, I'm looking for answers. And I think mentally I'm going to feel so much better just to have some answers. That's how I feel about it. So I just want to thank everybody so much for supporting me, for all your views, for all your comments. And if you have any questions or comments, please feel free to leave them. Other than that, I will look forward to being back after these procedures and let everybody know what the results were. So I'll look forward to seeing everybody then.